Thank you for joining us for this webinar and podcast. My name is Kathleen Toomey. I'm Vice President of Marketing at Riverwoods. And in the next half hour, we're going to take you through a few topics that we feel are going to help you understand how to know when your parents need help, what you can do about it, and if you need additional help, where to go for that. The presenters are Chris Hegarty, who is a licensed social worker, Director of Social Services at Riverwoods. She has more than 12 years' experience working with families in transition. Laura Sieblick is our other panelist, who is an assisted living counselor at Riverwoods, who has had also a tremendous amount of experience counseling families who are considering assisted living and want to know more about that program. So without further ado, I'm going to talk about the top objectives that we're going to achieve in this half hour. We're going to go over the top 10 signs when you know your parent may need help. We're going to suggest a way to approach the conversations with your parent. Thirdly, we're going to talk about how you can help as a caregiver or an adult child. We're also going to talk about how to understand what assisted living is and when it might be needed, when you may need more help than you can provide. We're going to also go over the resources that are available to you. And finally, we're going to wrap up by reviewing what the pricing variables are if you choose to decide that assisted living is for you. Chris is going to start off and talk about the suggested approach when working with your parents.
Thanks, Kathleen. This is a good time of year, making use of holidays or even casual visits just to look around and see how your parent is doing. You want to be an informed adult child. You want to kind of catch up on what's going on with your folks, what doctor's appointments they have, what might be lacking in the home. But before you do anything, ask your parents first about what's going on. Don't make assumptions. They deserve that respect, and they'll be honest with you. Be empathetic. Observe the key signs that you see, such as unopened mail, which could be a sign of failing eyesight, could be memory lapse, could be problems with handwriting, or even just the executive function of opening, sorting, and then paying bills. Food in the refrigerator could be spoiled or uneaten. That could indicate that getting out to shop is too much or cooking is too much. Again, diminished eyesight or a lack of taste can lead to lack of interest in eating. The thought of it's not worth it just to cook for one, particularly for somebody who's lost a spouse. Arthritic pain can hamper cooking because pots and pans are too heavy and it's painful. Or also if there's any dental issues or denture issues, chewing could be a problem. Within the home and hygiene, you want to see if there's a cluttered or messy home. Is this unusual behavior? If somebody's always been messy, then it's not. But if somebody's been historically neat and you come in and you notice things are really out of place, what's going on? Organizing and putting away may be just too much to do. Climbing stairs could be too much. Again, arthritis, the pain might be too much to pick things up or other limiting physical factors. Personal hygiene for someone has slipped. Again, you want to look, is this typical behavior? Is this someone who's always been groomed and ready to go? Or is this someone who really doesn't care if their hair is quite in place? That could be fear of falling in a tub or a shower. Again, poor eyesight. Your parent can't see the difference. Or physical limitations, perhaps a shoulder impedes somebody from really being able to comb their hair. Lack of interest due to limited social interactions, or it could be depression, is also playing in. Other possible concerns would be medications and doctor's appointments. Forgetting to take medications. This could be an indication of short-term memory loss. This could be depression, or this could be simply confusion and the inability to really follow the directions to take medications. Missed doctor's appointments could be an indication of lack of organization, inability to get the transportation, inability to actually have the executive functioning to put it all together to get to the doctor's office, or it could be depression or loss of interest. If you notice behavioral changes with your parents, repeated calls at odd hours with odd reasons for the calls, if you're at their home and you see scorched pots or pans, if you notice bruises on your parent, and when you ask, the reasons don't quite make sense. It could be frequent falls, or unusual behavior, or again, appearance. And this would be as opposed to their historic behavior or historic appearance. If somebody's been a little eccentric, then they're doing something odd. It may not be anything to be worried about. So how can you help? With frequent falls, the first thing you want to do is assist your parent or ask your parent to go have a complete physical and medication review. It could be as simple as tweaking one medication. You want to check for home safety, scatter rugs. You want to make sure there are assistant bars in the bathroom. It could be that physical therapy might help. Simply an adaptive equipment such as a cane or a walker might make the difference in preventing falls. How you can help with inappropriate behavior or appearance. Ask yourself, is this a single occurrence or is this frequent behavior? If it's a single occurrence, you probably don't need to worry about it. But if this is becoming a pattern of behavior, and it's a marked departure from their typical behavior, you want to, again, always consult a physician. If it's about appearance, it might be, is there a transportation issue to the hairdresser? But you want to, if there's more behavioral issues, consult a physician and even consider a psychiatric evaluation. With memory loss, it's important to know the difference between typical age-related memory loss, such as where did I put the keys, to something more serious where the keys are located in the freezer, or you notice your parent can't remember how to use something such as a fork or a spoon, which they've known their whole life. Again, immediately, you really want a medical assessment. You also want to make sure that medications are appropriate and that they're being taken properly. There could be interactions going on that are really making the memory loss or the confusion more apparent. Depression is something to assess for. There is, within depression, components such as lack of concentration, lack of memory that can mimic issues with the memory. And also, as people get older, urinary tract infections can become very serious and cause a great deal of confusion with elderly. So with memory loss, you want to absolutely go to the doctor first to rule out that it's anything physical. With depression, you want to know what's the difference between feeling blue or an actual deep depression. This is a time of life where many elderly folks are losing lots of they're losing independence, they're losing their friends, they're losing spouses. So this can be a time of life that depression really takes over. You want to, again, consider first going to the physician and having a full checkup if there hasn't been one done. You want to consider a psychiatric evaluation. And also, within that physical checkup, you want to ask the physician about medication interactions or possible side effects. And then you want to look at the environmental features that might be your parents not getting out the way they used to when they were very social. You might, again, notice that there's been multiple deaths, and see if you can get your parent to talk to someone about their grief issues. With personal hygiene, you want to look and see maybe why is this going on? Do you need a little extra help in the home with laundry or with grooming? It might be an easy fix just having some Velcro with clothing or shoes instead of difficult zippers and buttons. Or it could be another sign of a more serious condition or an illness. So you want to look and see the environmental features in the home that are preventing hygiene. And then again, you want to look to the doctor. If the house is unkept, how can you help? You could help by, again, seeing is this depression or something else going on, but getting some in-home help for your parent with cleaning or organizing. This might be the good time to help simplify. A lot of times elderly folks get really overwhelmed with paperwork. I know In my own home, I get so many mailers and so many papers, it's hard to keep up. And so it might be a little bit of extra help will just make the difference. And also you want to look for any dangerous conditions such as slippery floors, clutter on the stairs. Throw rugs are particularly dangerous as far as falls. So you want to look and see what you can do to maybe remove some of these obstacles. With the food being spoiled or uneaten, what you can do to help is, again, try to find out what the underlying medical condition might be. Is there weight loss? Is there depression? Help your folks get an eye exam. It might be as simple as an adaptive cooking aid that might help with the cooking, or moving things within the kitchen so they're easier to reach and that the microwave is within reach. Pre-cut fruit and veggies, though they might be more expensive, probably are more helpful. They're user-friendly and easier. And sometimes that's a barrier you have to get over with a parent because it costs more. But in the long run, they're not throwing out these products. You want to, most importantly, talk to your parents about the tasks that are hard for them or painful for them to do. You want to ask them how their sleeping is, and are they feeling more tired? Are they taking naps? Are they needing naps? And what is, what is causing them concern? Are they concerned in the shower? Are they concerned going up and down the stairs? Is there a loss of appetite? And what are their fears of what might be coming, as far as, are they fearing about their memory loss with dementia? Are they fearing that they won't be able to do their finances? It's really important to approach your parent with empathy. In these situations, if you can reminisce and with them about a time when things were better, a time when your parent was a help to you, a time when they were feeling stronger and more independent, you're reminding them of who they've been, you're reminding them of who they've been to you, and this also will help elevate their mood. Make scrapbook pictures, bring pictures, make a video, telling your folks who they've been to you, and stay in touch as much as possible by phone or by email or dropping in, and let them know you want to do this to help them, not that you're checking up on them, but you want to be part of their solutions. There are different available resources out in the community, such as support groups. You've got Diabetes Association, the Heart Association, you've got bereavement support groups that can be very helpful, caregiving support groups for yourself. There's also the Alzheimer's Association that has wonderful resources online. There's also professional assistance such as certified geriatric care managers, the Area Agency on Aging, and elder care attorneys can be helpful with financing and future planning. You want to involve your parent in all discussions and planning. Include other family members in the discussion. A united front is key to helping your parent in decision making, and you don't all have to agree, but you have to agree at least that you want to help your parent. And help plant those seeds early, so it's your parents' decision, and they feel empowered within that decision. Initiate the discussion early with your parents to avoid surprise or resentment. Discuss it before they need it, if you can. Just what can we do in the future when the time comes? Consider your parents' feeling of loss. There's a loss both of status, of self-esteem, huge loss of independence, freedom and control. And there's loss of relationships with friends and family. And don't discount that friends aren't as important as family. In my work with our residents, when people start losing all their friends, there's nobody that they can reminisce with about what it was like as they were aging. So at this point, I think I'm going to turn it over to Laura, who will be talking about assisted living.
Thanks, Chris. If you've noticed some of the signs that Chris just discussed, you may decide to research options for assisted living. They're not all the same. We'll talk about some important differences that you want to be aware of over the next slides here. The first being that some assisted living communities are owned and operated by for-profit, and some are owned and operated by not-for-profit. In a for-profit community, it's typically a standalone, traded publicly on the stock market. In a not-for-profit, the revenue is invested back into the community. One of the biggest differences here is the second bullet point. A standalone community will offer only assisted living services. So if your loved one in the future requires more assistance than assisted living communities can offer by state regulations, then you'd be looking at an additional move to a skilled nursing facility. This can be a big adjustment for a resident, as it means an additional move and becoming acquainted with staff as well as the staff becoming acquainted with your loved one. In a continuing care retirement community, you have the benefit of moving through the different levels as your loved one's needs increase. Tends to be less of a transition for your loved one. The biggest benefit is that your loved one's already familiar with the staff and the staff is already familiar with your loved one. There's often questions about the differences between services offered in independent living versus assisted living. This slide here goes through some of the benefits of assisted living that you'll typically see included in a rate. 3 meals a day are typically included, assistance with daily activities of living, bathing, dressing, toilet and walking, housekeeping, transportation, access to medical services, 24-hour security on site, emergency call systems, exercise and wellness programs, medication management, laundry services, social and recreational activities, which is extremely important, and a 24-hour staff on site. So now that we know what's included in assisted living, it's important to understand the cost and how the rate is actually determined. It's a major consideration. A lot of it will likely come out of your own pocket, and it's a big investment. So you want to make sure that you plan ahead, as Chris mentioned before, not waiting if you can talk about things ahead of time, and really taking the time to develop a budget. You want to think not just about your current needs, but you want to talk about the long term and what could be additional services that you may need in the future. Assisted living communities define their rates in very different ways, so it's important to understand how the monthly rate's determined and what's covered in each community's rate so that you're really comparing apples to apples. This next slide shows a few examples of different rate options. The first two, base rate plus levels of care and base rate plus a la carte services, are both based on two different components that we'll get into on the next slide. The all-inclusive rate is one rate that's inclusive of all the care needs. I just want to mention on this slide as well that there are some additional factors that you should consider when you're thinking about budgeting for assisted living or long-term care. There could be a one-time community fee that's charged at the time of move-in. The amount varies from community to community, and it usually covers costs associated with moving a resident in and out of the community, such as the nursing assessment and processing paperwork. And then another factor that you want to consider when you're doing your budgeting is cost of living increases. This could be anywhere from 3 to 7% depending on the community. Base rate plus levels of care. We mentioned that it's based on two components. The first component being determined by the size of the apartment that you choose. Another factor that can come in is if there is a proximity to a dining room or an elevator, there could be an upcharge, and you're always looking at the size. As I mentioned, it could be a studio, a one-bedroom, even some communities have two-bedroom apartment styles. Obviously, the apartment choice will also be based on the availability at the time that you tour the community and when your need is. The second community with the base rate plus levels of care rate is based on the level of care determined. So the level of care is added to the base rate to determine your full monthly fee. So an example here is a level 1 could include medication management, bathing, and dressing. A level 2 would include everything in level 1, as well as incontinence care, assistance to ambulate, that type of thing. There could be 2 or more levels of care in a community. So typically what happens is there's a nursing assessment every 30 days or as changes of condition are noticed, and then based on the assessment, the level of care could be increased as the needs and the care you need is increased. So if you need one extra service, it would put you into that next level of care, bringing you to that next rate. The second one is base rate plus a la carte services. This is also based on two components. The first being the size of the apartment that you choose, like we just discussed. The second being the additional services that you need. The difference with this one and the last one that we talked about is that you only pay for the services you received. So for example, if your loved one needs medication management, that's all you would pay for. Some examples here are for additional fees would be medication management could add $350, bathing and grooming could add $250, and incontinence care could add $250 a month. So the important thing is that you look at these additional fees per month and add it onto the base fee to get your true monthly service fee. The next one is the all-inclusive rate, and it's just like it sounds. There's no hidden costs and no unknown increases each month. So you would have the same nursing assessments as you would in the other types of rates. However, if additional needs are seen, your base rate wouldn't change. So again, as you research costs on assisted living, the underlying theme here is that you want to make sure that you're comparing apples to apples. You want to include all of your what ifs and not just necessarily what your needs are now. The first two that we discussed were the base plus levels of care and base plus a la carte services. You always want to look down the road and think about needs that you may have in the future and what would be the maximum amount that you'd be spending per month. The all-inclusive alleviates that additional thought process where whatever additional care you need will be included in the rate. We talked a little bit earlier ago how it is a big decision, it's a costly decision, something that you want to put some thought into. There are some additional ways to help pay for assisted living. One of them is long-term care insurance. If you have long-term care insurance, you want to understand what your policy will cover. They're all very different. Some pay a daily rate, some have a maximum rate, some will only pay for skilled nursing. So you definitely want to call ahead, talk to your insurance company, and find out all the ins and outs of the policy that was purchased. The second one here is a veteran benefit. It's based on income and assets. You can contact your local VA office to find out what the steps are to find out eligibility. The next one is Medicare. There's a lot of confusion about Medicare and what it does and doesn't cover. It does not cover assisted living costs. What it does cover is additional care, just like it would cover it if you were in your home. That would be covered under Medicare Part B, but it does not cover assisted living. The last option here is Medicaid. Some assisted living communities will accept Medicaid. You would need to call around and do your research and find out which ones those are, and that also is you need to be financially eligible to do that. The last slide here shows some of the resources. The first one is the Center for Medicare and Medicaid. The next one is the Alzheimer's Association, which is a wonderful resource. The third one, Department of Health and Human Services. The New Hampshire Conference on Aging, and then the National Institute on Aging. And at this point, I'm going to turn it back to you, Kathleen.
Thank you, Laura. And also, I wanted to just say that I think what we've done here is go over with you from the beginning, if you are concerned about your parents, what you can do to help them, what you can do to help modify their home or understand what medications may be interacting and causing things to happen, and also how to approach. I think Chris did a great job talking about how to approach the conversation with your parents so that you can help and they can understand you're trying to help. And then Laura went through, if you decide at some point that your parents may need assisted living, how do you understand what assisted living is, the different levels, and especially the contracts. So we also covered what the resources were for you from a standpoint of state and national resources. And I'd like to close by inviting you, if you have any additional questions, if you'd like to learn more, to contact Laura Seeplick directly at 603-658-7005 or researching our website, www.riverwoods, with an S, RC for retirement community.org, because we are a nonprofit. So riverwoodsrc.org has a lot of great information and details. Contact Laura, and good luck with your conversations with your parents. Thank you for listening.